Hi, quick question. If someone smokes a cigar but says, relax, I don't inhale, are they actually avoiding the diabetes related risks? Short answer, not really. And if you have diabetes, pre-diabetes, high blood sugar, or a family history of diabetes, this is especially important. Cigars often feel different from cigarettes. They are linked with celebrations, business milestones, weddings, clubs, and social occasions. So many people think it's occasional, it's premium, and I don't inhale, so it's not really smoking. But here's the part most people miss. The diabetes related harm from tobacco does not only depend on deep lung inhalation, it depends on what enters your bloodstream. And cigar smoke is very good at delivering nicotine into your bloodstream through your mouth. Why? Because cigar smoke is alkaline. That means nicotine stays in a form that can be absorbed directly through the moist lining of the mouth and nose. So even if you never pull the smoke deep into your lungs, nicotine can still enter your blood. And once nicotine is in the bloodstream, it can affect insulin sensitivity. Think of insulin like a key that helps move glucose from your blood into your muscles. Nicotine can interfere with that system, making it harder for insulin to do its job. The result? Blood sugar can stay higher than it should. That is one reason smoking is linked with insulin resistance and type 2 diabetes risk. Now let's talk about the second big issue, carbon monoxide. A large cigar can produce a very high carbon monoxide load during a smoking session. Carbon monoxide binds to hemoglobin, the oxygen carrying part of your blood. When that happens, your body delivers less oxygen to tissues. For someone with diabetes, oxygen delivery already matters a lot because diabetes can affect circulation, wound healing, nerves, eyes, kidneys, and the heart. So when carbon monoxide enters the picture, it adds another layer of stress. And remember, cigar sessions are often long. A cigarette may last a few minutes. A cigar can burn for 30, 60, even 90 minutes. That means a longer exposure window for the smoker and for people nearby. Now, to be fair, smoking one cigar occasionally is not the same as smoking multiple cigars every day. Frequency matters, dose matters, but lower risk than daily use is not the same as no risk. For a person with diabetes, even occasional cigar smoking can create a short term metabolic hit. Nicotine driven insulin resistance, carbon monoxide exposure, and extra cardiovascular stress. And that cardiovascular point matters. Diabetes already increases heart and blood vessel risk. Tobacco adds to that. Cigar smoking has been associated with serious cardiovascular outcomes like stroke, atrial fibrillation, and heart failure. So the real takeaway is simple. Not inhaling does not mean nothing is happening. Nicotine can still enter through the mouth. Carbon monoxide can still affect oxygen delivery, and both can matter for blood sugar and cardiovascular risk. So, what should you do if you smoke cigars and have diabetes? First, tell your doctor honestly. Don't just say, I don't smoke if you smoke cigars once or twice a month. Say exactly what you use and how often. Second, track your glucose around cigar events. If you notice higher readings the next morning, unusual fatigue, or poorer control after a cigar night, that is useful information for your care plan. Third, if you are ready to stop, ask about structured support. Nicotine replacement therapy, counseling, and medical guidance can help. In India, the National Tobacco Quit line is also available at 1800 112356. And one important Smoke Safer note. Smoke Safer Gold is designed for cigarette smokers, not cigar smokers. It fits standard cigarette filters and its lab testing is based on cigarette smoke. So it is not a cigar product. For cigar smokers working toward quitting, medical cessation support is the right first step. If someone is transitioning from cigars to cigarettes as a temporary step down, then cigarette filtration may reduce some smoke exposure per cigarette, but quitting remains the best choice. So the question is not just, did I inhale? The better question is, What entered my bloodstream and what does that mean for my diabetes risk? Stay informed. Be honest with your doctor. And if you smoke, keep moving toward quitting. I don't inhale does not mean no bloodstream exposure. Cigar smoke equals oral nicotine absorption. Nicotine can worsen insulin resistance. Carbon monoxide affects oxygen delivery. Diabetes plus tobacco equals higher cardiovascular concern. Tell your doctor exactly what you smoke. Quitting remains the best choice.